The burden facing cancer patients has increased in part because of the increasing costs of care, particularly some of the new treatment options and particularly drugs. But it's not really a new problem. Cancer patients really, for the past decade, have been faced with fairly expensive regimens because you need to consider not only sort of a specific drug that may be their second or third line therapy, but also all of the surgery and diagnostic, the diagnostic workup, the surgical treatments, the recovery from that, loss of employment, and then all of the lengthy treatments that may have out-of-pocket costs directly, but then all the indirect costs of transportation time that they may face. And it's really been something that's been documented for quite a while. So I think part of the challenge is that individuals faced with a life-threatening illness often change their decision-making processes, their preferences. And so somebody who, when they were well, might have said, I would never spend that amount of money on a cancer treatment, when they're faced with that decision for themselves or a family member, are willing to make that choice. They may not always have the financial resources to pay for it, and so you do end up with patients who are making choices and ending up with having to spend all of their assets, income assets, mortgage their home, declare bankruptcy, etc. And so I think that's really the problematic choice. You have patients who may proceed with expensive therapies who have the financial resources. For them, it's not an issue in our society. And then you have the patients who forego therapy because they don't have the resources and are willing to take the risk, make the choice to not proceed with therapy.